welcome to our briefing. This briefing is presented by WorldAware. WorldAware provides intelligence-driven integrated risk management solutions that enable organizations to operate globally with confidence. WorldAware's end-to-end tailored solutions, integrated world-class threat intelligence, innovative technology, and response services help organizations mitigate risk and protect their people, assets, and brand reputation. Right. Today we will be hearing from Jonathon Keymer. Jonathon is a senior intelligence manager at WorldAware, analyzing threats across Europe and Russia, and has worked in the travel security sector for a decade. He previously worked in the Far Eastern defense sector on internal security, CBRN defense and disaster recovery projects, and as a financial journalist in the City of London, examining issues around the global financial crash 2007-2008. Jonathon was brought up in Germany and Belgium and has worked around Europe, Asia, and Australia. He has a master's degree in WMD Proliferation and International Security from King's College in London and a BSc in Economics. All right, on that note, I would like to hand over to Jonathon.
Thanks, Jeremy. We'll be looking at several countries in the region in the context of 4 potential medium-term scenarios, which WorldAware has developed internally to show how the COVID-19 pandemic is likely to develop around the world. The scenarios are entitled Health First, Incremental Normalization, Business First, and No Normalization. We're monitoring a range of generic and location-specific indicators and benchmarking them against 4 key drivers to determine the relevant scenario. The drivers are medical infrastructure, government action, business response, and public sentiment. While no one framework will be a perfect fit to any one location, the general characteristics of each scenario are as shown. So health first, the government maintains strict restrictions which have a significant negative business impact, though crucially maintain public support. There's incremental normalization, which is what you might call the best case or least disruptive outcome. Government and businesses would carefully roll back restrictions and tread the fine line between public safety and sound economic management. There'll still be a moderate impact on business, but better than we might otherwise have hoped. Again, this scenario depends on the public remaining largely positive. Business first scenario, governments and businesses prioritize the need to get the economy going again and quickly roll back health restrictions, which has positive short-term effects for jump-starting the economy, but also has a negative impact arising from public health issues and consequent negative public sentiment. And it could even be economically counterproductive in the long run. And finally, we have no normalization, which would be when or if government and business restrictions remain in place, so we still get the severe business impact. The main difference between this scenario and health first is that the public is not on board, with widespread dissatisfaction manifesting itself as disobedience to government restrictions, growing political opposition, and civil unrest. So our first case study is Italy, which quickly became notorious for being the European focus of the disease in the early stages of the pandemic, though its lockdown and its economic impact were soon mirrored elsewhere. Although its medical capacity was overwhelmed initially in places, it maintained positive public sentiment over the lockdown, which brought time for the authorities to upscale their medical infrastructure. And while it's still early days, Italy is finally in a somewhat solid position for where it can achieve incremental normalization, and we rate that there's a 70% chance of this scenario being realized in the next 90 days. Our reasoning is that despite some early setbacks, case numbers have fallen to manageable levels. Italy has relatively good medical infrastructure and is now better prepared in case of a resurgence. The government has announced a phased approach to reopening the country and has begun easing some measures. Certain businesses and parts of the forestry and lumber industries were allowed to reopen on April the 14th, and since May the 4th, movement within regions has been allowed, though with restrictions on social distancing and longer distance travel remaining. The government approach still has broad public support, and the authorities are unlikely to feel pressured into prematurely lifting restrictions from that quarter. However, given the fact that the economy was facing a recession before the pandemic, the public is unlikely to wish to delay unduly either. We think there's therefore a small chance that the company will enter business first with the economy open, but with public dissatisfaction over the likely higher health impact. The long shutdown in Italy has also had the characteristics of a health first scenario, but if restrictions were to continue into the medium term, it would likely develop into a no normalisation scenario with widespread unrest and civil disobedience. A possible outcome could also be widening divisions between the north of the country and the financially weaker south, which had lower rates of infection but would still suffer disproportionately from the shutdown. So it all depends on the government's timing, and the government's timing as to when it relaxes the restrictions will likely depend on whether it can maintain public support. And public sentiment would depend largely on how confident people were that their livelihoods could be maintained. With each location, we're looking at a number of fixed indicators around things like household demographics, baseline health conditions, internet and telecommunications, and so on. But we're also monitoring a wider array of variable indicators. And in this sense, the indicators we're watching for Italy include medical data, so whether case numbers are continuing to fall in relation to intensive care capacity. We're looking at the reliability of such data, which will increase if there's widespread testing and contact tracing in place. Currently, several regions in the north have conducted extensive testing, but central and southern Italy are somewhat behind at this stage. We're looking into the provision or possible provision of adequate stimulus packages from the EU. We're looking for announcements around reopening the country for tourism, which is a major currency earner. And due to the coalition nature of the Italian government, shifts in public opinion could influence decisions about restrictions relatively quickly. So we're therefore monitoring political surveys as well as for any signs that the population is beginning to disregard government health mandates or advice. And one final word of warning on Italy, and an illustration of why every country needs to have these indicators examined in its own specific context. If we're examining public sentiment in Italy, widespread industrial action might be mistaken for negative public sentiment. But in Italy, transport strikes, for example, are routine under normal circumstances. So if we start seeing a resumption of industrial action, that could actually be an indication of a return to normality. With the UK, we've seen high case numbers and a high number of related fatalities. The UK has been shut down, though to a lesser extent than Italy, since late March. Case numbers have nevertheless remained within the capacity of the medical services and have now begun to fall. With increasing ICU capacity coming online over recent weeks, the ratio of capacity to requirement is widening. And we believe that the UK is also likely heading towards incremental normalisation. We rate that there's a 75% chance of this scenario being realised in the next 90 days. And our reasoning is that the government maintains broad public support and is not currently under pressure to rush in lifting restrictions. But with the end of the Brexit transition period looming in less than 8 months, and with calls from business bodies such as the British Chamber of Commerce earlier in the week for a phased easing of restrictions, it's likely that the government will want to move ahead as soon as it can, as long as it's certain that it's not going to endanger public health. Now, the UK's relatively good medical infrastructure has been boosted by emergency temporary infrastructure such as the Nightingale hospitals and provision of additional equipment. This, coupled with case numbers falling by around 13% over the last week, the government now appears confident that capacity is going to be sufficient to handle a resurgence, which is likely following a phased relaxation of any restrictions. But the government's also warning that some sections of the population will have to remain effectively locked down. And that could be sort of demographically vulnerable sections of society, such as the elderly, care homes, people with chronic diseases, and so on. The UK is also currently trialling a contact tracing app in the Isle of Wight, which is similar to systems being used effectively in Germany and elsewhere. And it plans to roll out contact tracing generally throughout the country by the middle of May. Now, the British system is facing criticism from some quarters, but if effective, it will help to contain transmission and thereby obviate the need for protracted restrictions. And again, the timing of the government's relaxation of measures is crucial. If it relaxes them too soon and cases rapidly rise in excess of medical capacity, the UK could enter a business first scenario. If it's too late and they unnecessarily maintain restrictions to the detriment of the economy, the UK could enter health first. Now, due to the relatively lower general threat from civil unrest in the UK, as well as the high level of current government support from the public, no normalisation is very unlikely in the UK in the short to medium term. So the indicators we're looking at, again, we're looking at the fixed indicators first around demographics and telecommunications and so on. But the variable indicators would be medical data. I mean, as the timing, as I said, is so important, the government's decision would depend on the medical data. So a key indicator would be whether there's sufficient data to indicate that case numbers are seeing a sustained drop in proportion to ICU capacity. And indicators of spare capacity would include how much the country is using emergency medical facilities, such as there's a 4,000 bed facility, Nightingale Hospital facility, which has been constructed at London's Excel Conference Centre. Now, these Nightingale or that particular facility and other Nightingale facilities have now been placed on standby. They're not being used but they're to handle current cases, but they're there in case for when the restrictions are relaxed and should case numbers begin to rise again. The UK's faced criticism in terms of testing capacity, but it has ramped this up significantly in recent days. The planned tracing procedures would also increase the reliability of the health data and indicate that health services will be better placed to manage a relaxation of restrictions. While government announcements of additional measures to mitigate longer-term economic damage, including support to businesses to enable flexible working and so on, while they could be part of sensible post-lockdown planning, they could also suggest that the government is planning for a protracted shutdown, and so we'll also be watching these carefully. And in addition, we'll be on the lookout for announcements around high-profile public events in the latter half of the year. So the party political conferences, which usually happen September, October, the Lord Mayor's show in November, and so on. If these are pulled and announcements that are sort of begin to be made that they're going to be postponed or cancelled, it would suggest the authorities are gearing up for a longer-term shutdown. Now, the government's approach, as I said, it's got broad public support. The government is not currently under pressure to lift restrictions from the public. It's got a strong majority and no election due until 2024, so it's relatively insulated from public opinion in the short term. However, public dissatisfaction could begin to manifest in growing disobedience to the restrictions. And while it's unlikely at this stage to include large-scale protests, an indicator of growing public dissatisfaction would be an increase in people flouting restrictions, gathering socially in small numbers, heading to the beach against government advice, all of which could prompt the government towards a more mandatory restrictions regime rather than an advisory restrictions regime, such as will likely be in place after restrictions begin to be relaxed. And all of these could indicate a move towards a more protracted shutdown. I will also be monitoring business surveys for signs around confidence regarding the long-term economic recovery. The UK economy is dependent on financial services, which are themselves dependent on confidence. A lack of confidence would add pressure on the government to relax measures, possibly prematurely. So the next case study, Turkey. Which is planning to start lifting restrictions next week from Monday. It's going to start with local travel restrictions in a number of provinces and minor relaxations of movement restrictions for people under the age of 14 or those over the age of 65. And it's also going to be looking at relaxing restrictions on some non-essential businesses. However, interprovincial travel is going to remain largely prohibited until at least the end of May, and international air and sea and most land borders are going to remain closed. So although a health first scenario is likely through the end of May, there have been high level discussions about reopening the economy, possibly from early June, but no official announcements have yet been made. Now, the public appears to largely support the government measures after widespread criticism of the government's perceived initial inadequate response. The number of hospital cases, though, continues to grow. So they're getting about around 2,000 new hospital cases a day, and any move to roll back movement restrictions before they've begun to see a sustained fall will almost certainly have a damaging and unpopular health impact, which would move us towards a business first outcome. The government is in a position to maintain a health first scenario currently. There's widespread public acquiescence to the restrictions. Big business appears reluctant to pressure the government to reopen the economy. Turkey has got a relatively good healthcare system, including a large number of ICU beds, and the healthcare system there commands a high level of public trust. Several temporary hospitals have also been set up in and around major cities to boost capacity. And in addition, Turkey's got extensive social welfare, which can support people who are currently out of work due to the shutdown. And together, these and the maintenance of positive public sentiment would enable the country to maintain restrictions before possibly moving towards incremental normalization in the next 60 to 90 days, with further restrictions being rolled back without overburdening the medical infrastructure. The health first approach of the Erdogan administration remains popular, and furthermore, the president maintains close ties to the largest industries in the country, and they're unlikely to mobilize public dissent against his coronavirus policies. Nevertheless, as long as the number of live infections continues to grow, there's a chance Turkey may double down on the health first approach, either by scope or by extent of restrictions, which could generate opposition. But given Turkey's strong stance against dissent, the current ban on public gatherings and widespread support for the coronavirus restrictions, significant public opposition consistent with a no normalization scenario is unlikely at the moment. So the main indicators we're watching are the rate of infection and available medical capacity, including the availability that might be of PPE and ICU places. The health minister said at the end of April that Turkey was currently at the virus peak. So we are looking for confirmation of a sustained fall in cases in the coming weeks. Economic data, the government's going to have to carefully weigh health concerns against the longer term economic implications of a prolonged shutdown. If the government is seen as caving to business at the expense of lives and public health, they may begin to see widespread public opposition. Turkey's got a recent history of clamping down on internal opposition, so it can be difficult to ascertain whether a protracted lockdown would be widely unpopular. If there is to be dissent, it will likely manifest in larger cities such as Istanbul and predominantly Kurdish areas, which have greater mistrust of the central government anyway. In these locations, we'll be monitoring public dissatisfaction, which could manifest as minor acts of disobedience, such as small household gatherings or trips to holiday homes as summer approaches, that kind of thing. And we'll also monitor for signals that the government might extend bans on public gatherings and large outdoor sporting events. So I'm thinking, professional football matches, etc., as well as whether the government's looking at maintaining restrictions on political rallies and travel over public holidays in the second half of the year. And Greece, early and drastic action by the Greek government was successful in controlling the infection, and it maintained general support from the public, despite there was some early non-compliance which prompted tougher restrictions, but the public's broadly been on side. Greece began to relax measures on Monday, and it's part of a three-staged phased plan. So local movement is now permitted. Ceilings on public gatherings have been relaxed slightly. They're still set at a maximum of 10 people, but that's there is movement there. Some non-essential businesses have reopened, and more are due to follow on Monday, May the 11th, which will mark the beginning of phase 2. Phase 3 will involve the lifting of remaining movement restrictions and the reopening of public places. Now, the government plans are contingent at every stage on case numbers. If they rise too steeply, then the progress toward the next stage will be delayed and the reintroduction of restrictions is possible. So they could move back by a phase if necessary. Now, with this very cautious, health-led but broadly popular approach, Greece is well placed to head toward incremental normalisation. And we think there's a 50% chance of this scenario being realised in the next 90 days. Now, some in the international community have praised Greece's approach as a great example of how to deal with a pandemic. However, it's got a fragile health system, it's got low testing capacity, it's got a weak economy. And there are other factors such as the presence of large refugee camps, which could provide fertile grounds for contagion. It's got a relatively old population, there are various factors that could make it particularly susceptible if restrictions are relaxed too fast. And that could pressure authorities to maintain restrictions, which could lead Greece toward a more health-first approach. However, a lot of these factors that forced Greece or persuaded the Greek government to act swiftly and decisively early on, so the fragile economy, the relatively weak healthcare system, they also make it particularly vulnerable to becoming overwhelmed if it turns out restrictions are lifted too early. So a relatively low testing rate would also mean that data the government is assessing could be flawed. And a premature decision based on misleading data could actually mean that Greece moved towards a business first scenario, particularly if rising case numbers are not identified at an early stage due to sort of inadequate testing, for example. Now, if restrictions are protracted or reintroduced, the state of the Greek economy, particularly during the usual tourist season on which the country is heavily reliant, could begin to take its toll on public sentiment. And this could manifest in public disobedience, demonstrations, and possible increased antipathy towards migrants and those working with NGOs supporting refugee camps, for example, those on the Aegean Islands, especially if outbreaks are identified around such facilities. And this would indicate a no normalisation scenario. But the government is riding a wave of popular support at the moment, both in terms of it's won a majority of seats for the first time during the 2019 election, and also because it's seen to have handled the pandemic very well domestically. So a no normalisation scenario is very unlikely in the medium term. And again, we're looking at the following factors: case numbers that might indicate a second wave. Though, as I mentioned, the data might be flawed. We're going to be looking at whether ICU capacity is under strain. It's not under strain at the moment, though. If it were to become, a bit more full, then that could be something that could indicate a second wave better than the official case numbers. Greece has got powerful labour unions with widespread public backing and membership. So we're looking for signs that they're planning to protest against, say, reopening businesses. If unions judge that the health of the workforce is not being considered adequately, that would likely lead to it would not be a secret that the unions were dissatisfied, and that could indicate perhaps pressure the authorities to maintain restrictions and bow to the unions. Conversely, economic hardship from a prolonged lockdown could prompt protests to demand government financial support, which could also indicate a tentative move toward no normalisation in the longer term. And we're looking at general indicators of public sentiment and obedience. So, for example, in the early hours of yesterday morning, hundreds of youths gathered in northern Athens in defiance of the lockdown and fought with the police, who reportedly responded with tear gas. And again, as with Italy, this might be a reversion to the Greek norm, but it's the kind of thing we're looking out for as a pattern as to whether public sentiment is beginning to be frayed over the restrictions. Now, I wanted to mention in passing Sweden. It's not a proper case study, so I'll be brief. It's just a lot of people have noted that Sweden's got far less stringent restrictions than many of its neighbours. And I just wanted to say, while on the face of it, Sweden looks like it's a case of business first, so the government has got very loose restrictions and people can do what they like, it's in essence self-policing, and there's widespread adherence to public health recommendations. And these actually mean that daily life and business operations are effectively just as limited in Sweden as they are elsewhere in Europe. So while Sweden's case numbers are higher than its Nordic neighbours, they appear lower per head than many other European countries. So while Sweden has been criticised for its proportionally higher death tolls and case numbers than, say, Norway and Denmark, its response has not been ineffective. And it's proportionally in a far better situation than the UK, France or Italy, and many other countries that have mandated tougher restrictions. So I just wanted to stress, Sweden does have restrictions. They just arise from voluntary public action rather than government mandates. And this approach might not work anywhere else but Sweden, but it does look likely that Sweden is going to achieve incremental normalization. So that's an example of where the scenarios don't fit every country perfectly. The fact that many countries in Western Europe have strong medical capacities, they've got strong states, they've got engaged publics, coupled with constructive and collegiate cross-border cooperation. These all suggest that incremental normalization is going to be the most common scenario, or the most likely scenario, across the region. However, those countries that suffer higher economic or health damage, which will likely be blamed on the government, the local government, will also have the potential to achieve shades of business first or no normalization. There's going to be no identifiable moment when the impact of the pandemic suddenly ends. So I've heard people talking about, hey, we're going to have a great party when this is all over. There's not going to be a moment where you can judge it to suddenly have been all over. So residual restrictions, possibly targeting people by age, location, occupation, these restrictions will remain and likely be reintroduced at short notice for the foreseeable future. And many people were likely to continue to restrict their own activities out of an abundance of caution long after the government has relaxed its own official measures. So for example, it's going to be a long time before football teams are playing to packed stadiums again, even if restrictions on such activities are relaxed. And even the idea of normalization is relative. So I'm conscious of the fact that the new normal, the phrase the new normal, is getting a bit hackneyed. But it is quite a decent way of looking at it. It's not a new thing. Think about it this way. The Western world never really returned to normal after 9/11. It never really returned to normal after, World War II. Nothing ever returns to normal. Normal just evolves. And what happens is individuals, countries and businesses all adapt their routines. And in this case, it will be through habitual, procedural and ingrained social distancing and flexible working and more cautious travel procedures and so on. And that what we consider normal will change, but not in an earth-shattering way. Normal will just continue. So that's what I had to say. I will open it up for questions.
All right. Thank you very much, Jonathan.